We have these really nice exam rooms that are very light and airy. We have the glass here. We have all these great windows up here on the 4th floor. We have a big screen where we put all the x-rays up for you. We give plenty of clinic time for you really to get all your questions answered. And this is our table where we sit around together and do patient education together, including teaching you about the long-term histories of scoliosis. We also have various examples here of conservative and surgical care. This is just a great example of a Schroth patient. You can see this 10-year-old boy had a very significant kyphosis here and did Schroth exercises, learned how to do them over about 2 or 3 months, and look at the dramatic improvement with his kyphosis. And we can see this with scoliosis as well, which is just awesome. This is actually an example of a Schroth patient getting improvement. You can see this patient had about a 29-degree curve and did Schroth for several months. And look how much better a curve looks. That is awesome. That is just a success that can help that patient for the rest of their life and often decreases pain as well. And these are just some surgical examples. This is an example of a teenager who had a 56-degree curve, and then she had about a 3-hour operation. You can see how nice and straight we got her spine. And she went back to swimming and gymnastics, even diving in the pool, and is doing incredibly well. And then we also take care of young adults. This is an example of a young adult. She likes to do roller derby out in Boone, and you can see she waited and her curve got pretty bad and was suffering pretty badly. So she needed a slightly larger surgery, but she was able to go back doing roller derby with a Hay Clinic shirt. And we even help the older adults. This is a 74-year-old that had a very, very bad curve and was really losing her independence. And so we had to do about a 6-hour operation. You can see we could even help her as well. So in some families, we help 2 or 3 generations, often in the same things. We're going to be treating the mom, the grandmom, and the patient. And that's pretty cool. That's that lifelong care that I was talking about. So this is what a typical clinical room is like. One of the things that we would do for you and your child is do this thing called a scoliometer, and your pediatrician should have one of these. This is a very simple tilt gauge. And we actually put this on the child's back. And you can actually even do this at home if you want with your own child, even if you don't have a scoliometer. If you take out your smartphone and you actually open up the measurement app on your iPhone and then turn on the level does the same thing as this. And so if your child has scoliosis, or if you have scoliosis, there are always humps, at least one hump. And that hump basically creates an angle on the back. So you just check the upper back, the middle, and the lower back. And your pediatrician can do this too. So even if your pediatrician isn't used to doing it, you can be a scoliosis missionary and encourage them to do it. And all they have to do is put the iPhone on their back and then just move it down and check the angle. If the angle of trunk rotation, or ATR, is 5 degrees or more, then that means you should check an x-ray. And we could do that for you here. So anyway, angle of trunk rotation, 5 degrees. So I call this 5 at 5. Start screening around age 5, and if there's a 5-degree angle, go get yourself an x-ray and get it checked at a scoliosis center. So remember, 5 at 5. You can even do it yourself.